This is a very positive outcome today. 2 years ago, the WHO recommended the use of the RTSS vaccine for children who are at high risk of contracting malaria in Africa. Doses were allocated earlier this year to 12 countries, with rollout expected starting this year into next year. The problem is that we know that there is a significant gap between supply and demand of that vaccine. By having a second safe and effective vaccine now recommended by the WHO, this will help to accelerate and expand access to another malaria vaccine that disproportionately affects children who are at high risk of disease.
Yeah. Will there be more supply of this vaccine?
Yeah, so the Statens Serum Institute, who will be making R21, have indicated that they hope to provide 100 million doses initially and to double that over the next 2 years. So this recommendation by WHO starts that process of procurement and purchase of these vaccine doses for the eventual rollout of the vaccine starting next year.
How effective is this?
So the WHO has stated that there's no evidence so far that this vaccine is any more effective than the previous vaccine that was recommended, RTSS, because they haven't been compared in a head-to-head trial. What we do know, however, is that if children are vaccinated prior to the start of a very high transmission season, that it is highly effective following 3 to 4 doses. And the WHO is recommending a 4-dose regimen for this vaccine. It could be that they will need annual boosters subsequent to that.
Yeah. Does it work differently to the other vaccine?
So, no, interestingly, we think that the mechanism of action is very similar. Both vaccines are trying to stimulate an immune response that kills the parasite before it actually gets into the blood.
Interesting. We know that a lot of the problem is centred in Africa, but there are many Pacific nations that are very vulnerable to malaria as well, aren't there?
Yeah, so I think that's what we're really hoping with the recommendation from the WHO for this second vaccine. Now there will be more vaccine available, that it can actually be rolled out beyond Africa into other countries where there are children who are at high risk of contracting this deadly disease.
Yeah. I'm interested to know whether, global warming, and particularly that is impacting Pacific nations and other nations in the region. Does global warming, the warming of the globe, increase the risk of malaria and sort of multiply the mosquitoes further?
Yeah, so what we think climate change will do, and not just to malaria, but to other mosquito-borne diseases like dengue, it will actually increase the range that the mosquitoes can basically operate in. Wherever those mosquitoes are found, you're at risk of malaria. And at the moment, half of the world's population is at risk of contracting this disease. So we can only expect that to increase with an increase in global temperatures.
What about the cost of rolling this out? How is that cost going to be borne? And is it going to be cheap enough for these sorts of nations to be able to supply to the people that need it?
The indication is that this vaccine will cost between $2 to $4 a dose, which is very cost effective. Vaccines ultimately are the most cost effective public health measure in the long run. When you try and look at the impact of malaria on communities, if someone's sick, the time that they're not able to work, all of the infrastructure that has to go into being able to treat malaria and detect malaria. Ultimately, a vaccine is a much cheaper option than having malaria rampant in these communities.
Yeah, for sure. What is your expectations as to how soon this might be able to reach those that need it most?
Well, they've indicated, or SSI, Statens Serum Institute, have indicated that they hope to have vaccine doses ready as early as next year, so with vaccine rollout starting next year. So hopefully with both this and the RTSS vaccine available, we will see a substantial rollout in the countries that need it most.
Terrific. Well, that's really exciting news. Great to have you on, Daniela. Thank you.
Thank you very much.